Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for neurasthenia. What is neurasthenia? WHO's International Classification of Disease ICD-10 presents a set of inclusion and exclusion criteria for diagnosis of neurasthenia. Core symptoms are number 1 mental and or number 2 physical fatigue along with at least 2 of the following symptoms: dizziness, dyspepsia, sleep disturbance, irritability, muscular ache, tension headache, inability to relax. Exclusion criteria being panic or general anxiety order and mood disorder. In a few countries of the world, this disorder is referred to as chronic fatigue syndrome. That is, this neurasthenia term is a bit old one, may not be in use, but still it is in the medical world. As you have noted that ICD-10 contains this, but in a few countries the term is not available. They use this chronic fatigue syndrome term. What are the causes of neurasthenia? Erroneous lifestyle, somatic depletion. Somatic means physical. Overwork, too much of intellectual activities, want of amusement or recreation, lack of physical culture. That is completely, most of the cases are actually relates to lifestyle actually. These are all lifestyle. Is neurasthenia life-threatening? Not at all. It has become a part and parcel of modern life. However, if pushed to extreme, it may hamper severely with the daily life of a person. It may be so that he will be unable to continue his normal duties efficiently if it is continued and pushed to the extreme stage neurasthenia. What can one do to keep off neurasthenia? That is preventive. Get enough B and D vitamins, namely this type of food: yogurt, fatty fishes, spinach, green peas, asparagus, almonds, eggs, lean meats, etc. Get foods rich in antioxidant like all types of berries, walnut, dark leafy vegetables, rainbow fruits or foods, veggies, that is different colors of food and fruits. Take ginger, food rich in magnesium and potassium like quinoa, pumpkin seed, fresh fruits. Take green tea or chamomile tea. Perform asanas, especially sarvangasana, and calisthenics. Walk barefoot, breathe deeply. On the right hand side, this is a picture of sarvangasana. Keep self well hydrated. This is actually breathing exercise, deep breathing exercise. Keep self well hydrated, that is take at least 2.5 to 3 liters of water to drink. Shun all addiction like smoking, drinking, drugs, etc. Get adequate rest and deep sleep for at least 7 hours. Get Epsom salt bath at least twice a week. Epsom salt bath. Get constitutional treatment of underlying chronic diseases. That is, if one of the reasons of neurasthenia may be chronic diseases, then get constitutional treatment. That is the best treatment available in the modern world till days. When to consult a doctor in case of neurasthenia? Neurasthenia is a type of chronic affection, not an acute disorder. Generally, patients get adapted with the mild sufferings, thus the problem becomes chronic. However, there are a few sayings which are time tested. For example, a stitch in time saves the nine. So it's a bad idea to procrastinate in such cases. Consult a good physician as early as possible. How to manage a patient of neurasthenia? If one attempts to manage a patient of neurasthenia with remedies only, one can seldom succeed. During course of case taking of a patient, all his personal histories like lifestyle, addictions, habit, time schedule of taking foods, drinks, time to go to bed, time of rising up in the morning, everything should be taken down in black and white precisely. For a chronic case of neurasthenia as suggested by Dr. Henneman, the obstacles to cure and maintaining causes of the ailment must be found out critically, and the patient should be apprised of the same regarding their mitigation. Without caring for these aspects, remedies would not give permanent result. Now we are coming to homeopathic remedies. MAC-PHOS for neurasthenia. Top remedy for all types of neurasthenia, but symptom must correspond. What are the symptoms? Worse from cold air, cold water, touch, movement. That is, patient feel worse in these situations. Better from external warmth. Pressure sometimes relieves, sometimes worsen. Pain change places. In neurasthenia there is muscle ache, pain. So this is the nature of this particular patient. Caliphos for neurasthenia, lack of sleep, palpitations, mentally too much restless, depressed, gloomy, fear of death, nocturnal terrors. Anacardium for neurasthenia, loss of memory, constipation, involuntary excretion of semen, tendency to curse and swear. This is a general nature of anacardium patient, tendency to curse and swear. Platina for neurasthenia, weakness of nerve due to sexual excesses. Ladies especially full of self-pride, think themselves superior to all, hate all others. This is the nature of the platina patient. Ignatia for neurasthenia, no stability of mind and mood. That is, everything is changing. The mind is changing, mood is changing. Weep now, laugh then. Bad effects of sorrows, bereavement, mental shock. That is, if this neurasthenia, origin of neurasthenia is bereavement or some mental shock, then ignatia is one of the good medicine. Argentum nitricum for neurasthenia, constipation, loud belching, sometimes diarrhea, crave sweets. These persons, argentum nitricum patients, crave sweets. Looking down from height make them dizzy, often feel impulse to jump down. These are the general nature of argentum nitricum patient. These symptoms will be always there if, in whatever may be the disease, if the particular patient is actually argentum nitricum patient. Looking down from height makes them dizzy, often feel impulse to jump down, because this symptom relates to the person, not any disease. Picric acid for neurasthenia, very weary and weak. From a little labor, backache, brain fags owing to excessive use. Excessive use means use of brain, that is mental work. Carbovage for neurasthenia, accumulation of wind in upper abdomen, crave fresh air, look for foods which make them sick. This is a peculiarity of carbovage patient. The carbovage patient always look for that type of foods which make him worse. That is, his situation will go worse. That is his most important food he likes to take. He or she likes to take. Gelsemia from neurasthenia, get angry easily, like to move around always, think if not moving, heart would stop beating. Peculiar mentality. The patient feels that unless he or she goes on moving, his or her heart may stop beating. Heaviness at the base of the brain, they are dizzy, drowsy, dull. This patient are dizzy, drowsy, dull. Easy depression from heat of sun and summer. These are all general picture, general mentalities or generalities or general symptoms of gelsemia. It will present in everywhere, whether patient needs gelsemia, when he needs gelsemia. Acid phos for neurasthenia. Troubles due to overindulgence to sex. Overindulgence to sex, homesick, suffer from diarrhea and spermatoria. I have given a short note on the right hand side. Neurasthenia are mostly chronic. In chronic cases, use 200 or above with suitable interval depending on situation. Occasionally, acute case may be there. Use 3 to 30, that is potency 3 to 30 in frequent doses. With this, this video ends. Thanks for listening and viewing. If you feel any problem, please write down in the comments. I will certainly respond.